Good evening, everybody, and welcome to tonight's class on stretches. So, why is this important? Well, a lot of people know how to stretch, or do they? A lot of people know how or what stretches to do, but the problem is the efficacy of how to stretch is not really taught. And that's what we're going to talk about tonight. So, why is it important that I talk about this as a chiropractor? Well, I'm sick of my patients coming in who hurt themselves trying to do the right thing. One of the worst things I can see is these people before marathons or triathlons thinking that they're helping themselves, but they're actually causing harm. So let's talk about a stretch. What does a stretch really do? Well, it increases blood flow to that muscle, therefore allowing more circulation, therefore allowing more oxygenation of that particular muscle. So it, in theory, helps it to recover quicker, last longer, etc. Right? So that you're not causing as much damage if you did that without. So now let's look at if you stretch it improperly. Well, what are you doing? You're actually not truly even stretching the muscle. You're causing something called the Golgi tendon organ, which your muscle goes into a tendon, and right at that junction of muscle to tendon is this little organ called a Golgi tendon organ. And what that does is it's a stretch receptor. It says, hey, I'm being stretched, contract. Okay. And that's what we feel as that initial stretch. So if I was going to stretch my shoulder out and I'm stretching across, right, my deltoids, and there's a stretch. And I feel that and I just hold it there, I'm not getting any stretch. But if I wait 5 or so seconds, that stretch somewhat, you'll feel it relax a little bit, and then you actually pull it for a true stretch of the muscle, okay? And you're going to hold that stretch for now 30 seconds. 30 seconds. 15 minimum, but preferably 30 seconds. So you're holding it here. And a lot of people are like, but doc, that's a long time. Yeah, it is. But you want to actually get that whole muscle to fully relax. Once it's been about 30 seconds, and I know we're probably about 20, I haven't really been paying attention, you slowly release that muscle. Notice it's taking about 5 or so seconds for me to get that muscle to relax or regain where it was. You see, if you stretch, like a lot of these people that just, you see them do this before they go for a run or what have you, and they do the same thing with the hamstring. They grab their ankle and pull it up to their butt real quick, bounce it a few times, and they're like, yeah, I'm ready. Well, how's a torn Achilles feel? Or a torn hamstring? Or a torn quadricep? Because that's really what's going to happen. Okay? Might not happen the first time, or even the 5th time, or whatever, but it will eventually happen if that's how you stretch. It's going to happen. You are damaging those muscles. And I can't tell you how many patients I've taken care of that were active, right? And I mean active because they were actually active, but they weren't prepping themselves with proper stretching for that activity level, like pickleball, okay? You want to talk about one of the sports that I see the most injuries in, it's pickleball. Why? Because it's not 20-year-olds or 15-year-olds or 30-year-olds playing it. It's 50s and 60s and 70-year-olds playing it. And they're not stretching beforehand, and they're not ready to play these sports. And so therefore they end up hurting themselves. And I have had, in recent memory, 3 Achilles injuries from people playing pickleball. So you need to do your stretches, but you need to do those stretches appropriately. Okay. So what are the appropriate stretches? Well, the appropriate stretches is figure out what stretch you're actually supposed to do, whether it's a hamstring stretch, a quadricep stretch, an IT band stretch, a piriformis stretch, a psoas stretch. You get the point. What muscle are you trying to stretch? Figure that out first and foremost. Talk to your doctors. If you don't have anybody to talk to, call me, right? Set up a consultation with me. Whether you become a patient or not, you can ask me questions. I'm here to help, okay? Would I like you to be a patient? Of course. But it's not because of the reasons you're probably thinking. I'm not here because of the finances, okay? Yes, I have to pay bills. Yes, I have to pay my team. Yes, I have to do things of that nature, but that's not my main motivation. My main motivation is to help you and your family, and therefore our community, achieve a better level of health. If that's helping you to find a way to lose weight, if that's helping you to find a way to get out and do a little bit more, how to play pickleball without hurting yourself, or maybe it's because you actually want to know how chiropractic can help you in the long run. Those are the reasons why I do this, not the almighty buck, okay? So if that's the case, give me a call. Let's set up an appointment. Let's sit down and figure out what the best stretch is for you. That's the first thing. The second thing is how to stretch it. And that's huge, right? We talked about a 5-second hold once you feel the stretch. Push a little further, a 30-second hold through that stretch, and then a 5 to 10-second release of that stretch to relax that muscle back into position. That's number 2. Remember I said there's 3. The third is how to properly recover. Well, stretches cause something called lactic acid formation. This is what happens when we go to the gym and we feel the burn. That burn is actually lactic acid, which is a very crystalline structure, which actually shreds muscle tissue, hence the pain, okay? So one way to flush that out of our system is water. Water is a huge thing that helps flush. How much water should you be drinking? Well, half your body weight in fluid ounces a day. So if you're 160 pounds, you want to drink 80 ounces of water a day. Minimum. Okay? If you're working out and you're active and you're sweating and perspiring, or it's hotter, or you're drinking a lot of other fluids like coffee, tea, beer, wine, etc., you want, which are all diuretics, by the way, you want to replace those and do your 80. Excuse me. Or you want to, like on those days where you're perspiring or it's hot or what have you, you're active a little bit more. You want to go up to as much as 3/4 your body weight. So if you're 80, you want to go to 100, or if you're 160, you want to go to about 120 ounces of water. Well, 128 is a gallon, right? Now, I'm about 240 pounds. Sorry if that just on the mic. I'm about 240 pounds, all right? So 128 ounces would actually be if I was 256. But I shoot for actually a little bit more than that. I shoot for about 4 liters a day, which is a little bit more than a gallon, okay? Why? Because I have water in liters. That's the only reason. I just try to drink 4 liters. That's the only reason why I try to drink it, okay? Now I add ice into my cup, so I'm probably getting about 4.5 liters when you stop and think about it, because the ice melts, yada, yada. So that's fine. I don't care if you drink more than you're supposed to. I want you to drink at least half your body weight in fluid ounces, okay? The other thing, if you are working out and you're doing a marathon or you're doing a longer run, there's a couple things that really do tend to help muscle recovery. One of those things is actually pickle juice. It's because of the probiotics in it as well as the electrolytes in it. Those are what really help. And if you're not lactose intolerant, believe it or not, chocolate milk helps a great deal in muscle recovery. So you can do those 3 things. 1, know what stretch you're supposed to do. 2, stretch it appropriately. And 3, make sure you recover it. And if you want to know more about how chiropractic, myself, my practice, my family, can help you achieve the best for you and your family, give me a call. Let's set up an appointment and get you started to better health today. I hope you all have a beautiful week. I look forward to seeing you all later this week and early next week for your adjustments. Thank you very much and have a beautiful night. Bye-bye.